know me, I'm Michelle Lampl, and I serve as the director of the Center for the Study of Human Health, co-director of the Emory Predictive Health Institute, and I'm a Charles Howard Candler Professor of Human Health on the faculty of Emory University. We are pleased to have so many students, alumni, and members of the Emory community here with us tonight. It is my great pleasure to welcome you to the 2021 Berson Lecture. The Harold and Florence Berson Lectures are presented through the Health Innovation Concentration, a collaboration between the educational programs of the Center for the Study of Human Health and Gozueta Business School here at Emory. This series highlights the intersection of health and business. One couldn't imagine a more important point right now. It is made possible by support from the Emory alumni and parents, Denise Berson Tansman and Mitchell Tansman, in honor of Denise's parents. Both Denise and Mitchell graduated from Emory in 1981. And by the way, their daughter graduated from Emory in 2018. And Mitchell is a trustee of Emory University. Thank you, Denise and Mitchell, for your generous support. Tonight, we are delighted to present speakers from two of Atlanta's leading employers, community and corporate citizens, Delta Airlines and Emory University, who've enjoyed a long-standing partnership that has created global impact. Never has the partnership been more critical than during the COVID-19 pandemic as businesses transform overnight. The strong relationship Delta has built with the medical community at Emory Healthcare, and particularly with Dr. Carlos Del Rio, Executive Associate Dean and Infectious Disease Professor at Emory School of Medicine, has been critical to its corporate resilience. We are delighted to have Emory's Dr. Del Rio and Peter Carter, Executive Vice President, Chief Legal Officer, and Corporate Secretary for Delta Airlines Worldwide. They will be leading our conversation this evening. It is difficult to simplify the accomplishments of these two individuals. Carlos Del Rio is a distinguished professor of medicine in the Division of Infectious Diseases at Emory University School of Medicine and professor of global health and epidemiology at the Rollins School of Public Health. He is also executive associate dean for Emory at Grady, the principal investigator and co-director of the Emory Center for AIDS Research, and co-principal investigator of the Emory CDC HIV Clinical Trials Unit, together with the Emory Vaccine Treatment and Evaluation Unit. He is furthermore associate editor for Clinical Infectious Diseases and senior editor for HIV for the New England Journal of Medicine Journal Watch Infectious Diseases, as well as an editorial board member of Global Public Health, Journal of AIDS and Women, Children, and HIV. He has co-authored 5 books, 30 book chapters, and over 450 scientific papers. Peter Carter has served as Delta's Executive Vice President, Chief Legal Officer, and Corporate Secretary since July of 2015. As Chief Legal Officer, Peter oversees Delta's legal, compliance, and government affairs groups worldwide and serves on the Delta Leadership Committee. Peter's team works to protect the interests of Delta's employees, customers, and communities. During the pandemic, he was pivotal in securing payroll protection that saved tens of thousands of aviation jobs. He is a fellow of the American College of Trial Lawyers and has been recognized by numerous organizations and publications. He has been honored with the Burton Award for Public Interest and is named one of the best lawyers in America for Bet the Company and commercial litigation. This evening, Dr. Del Rio and Peter Carter will discuss the partnership between Emory and Delta and the tremendous impact that COVID has had on their business, both now and for the future. During the program, I encourage you to submit questions you may have to the chat. And now, Dr. Del Rio.
Thank you, Michelle, and thanks to everybody, and I particularly want to thank the Tansmans for funding this lecture. I think this is a really important topic. I personally think that a guiding principle that I've had is that I think we have heard over and over, is this, throughout this pandemic, is this about public health, or is this about the economy? And I want to emphasize that, to me, you need strong public health in order to keep the economy, and economy and public health have to work together. And I think it was a mistake to think that this was public health versus business. This really needed to work together. And I think what the partnership we developed with Delta is precisely about that, is this whole idea of how can you bring the expertise of different institutions at a time of crisis, and do it in a way that it improves not only the condition of the company and its employees, but also of the public at large. And I think, this pandemic has been, in my mind, a very good example of how this could be done in many places. And I spend a lot of my time outside my regular work, working with not only Delta, but the NCAA and many other, corporations like, Royal Caribbean Cruises, et cetera. And the whole idea of the Atlanta Opera, the Atlanta Symphony, and it's all been about really thinking about how can we continue a successful business at the time of a pandemic. I would say that the partnership with Delta originates, well, first of all, originates because, I am a big Delta fan. I tell people that I live in Atlanta in great part because this is the home of Delta Airlines. As somebody who is, does global health, and I was the chair of the Department of Global Health at Emory for 10 years, over the last decade or so, I have, routinely flown over 100,000 miles and, all over the world. And it's because of Delta Airlines that I feel like I'm connected to everywhere in the world. And I think that's a huge privilege that we have here in Atlanta. Not only do we have the biggest airport in the world, we also have an airline like Delta that really connects you and takes you anywhere. If it's not with Delta, it's through its partnership with, Korean, Air Mexico, and Alitalia, and Air France, and KLM, that you really, I can fly between here and Kenya and do so in essentially 2 flights, right? And that's because we have Delta and its partners. So for me, Delta is critical to the success of what I do and what many of us do at Emory and in Atlanta. So early March of last year, I had just come from a meeting at HHS in DC. Actually, my last trip to DC was that one. I had come from this meeting at HHS in which we discussed where things were in the pandemic, and it was very clear to me that this was going to be very serious. So I had the opportunity to speak at something called the Atlanta Committee for Progress, the ACP, which is a group that the Atlanta mayor puts together with business leaders and with leaders of education. The president of Emory sits there, and community leaders in Atlanta, and it's an advisory committee to the mayor. And I spoke at that committee, and Ed Bastian, the CEO of Delta, was there, and it was really this wasn't a Zoom. This was a conversation that I did in person. Again, last one that because ever since I've continued to speak to ACP now on a regular basis, but I've done it in Zoom. But that was in vivo, and I think at that meeting I spoke with Ed, and I said, I'm very concerned about the impact. We're already seeing the problem with cruise lines, and I think there's going to be a problem with airlines, and we need to think proactively about this, and we need to think about what kinds of things can be done in a proactive way to ensure that what happened in cruises doesn't happen in planes. There's lessons for us to be learned. And Ed, in a very quick way, literally, I think by the next week, he said, we got a team together. We need you to join a call. And he brought a whole bunch of people together, and we started having discussions about, all sorts of things. And I had to quickly educate myself in things like, airflow in planes and boarding and onboarding procedures and all sorts of things. And I would say that through those different discussions, I got to work with Peter as chief counsel for Delta. And what I will say is that first and foremost, I would give a big credit to Delta that really, Ed, from day number 1 said, we need to do what we need to do to ensure the safety of our crew, the safety of our passengers, the safety of our employees. And it wasn't about, you know, oh, this is going to hurt our profit margin. This is going to be, he said, we need to do whatever it takes. And I think it reminds me a little bit about, you know, I always tell myself, when you get on a plane, the first thing you hear is the security announcement, right? And the first thing you hear is our number one priority is your safety. And I think that guiding principle was critically important in ensuring the success of this partnership. I don't think there's one thing that I've suggested to them they do that I've heard, well, that's going to cost us money, or I don't think we can do that. It was every single time, it was putting safety and security of passengers and crew ahead of anything else we did. And for that, I think, again, it is an absolute credit to Ed, to Delta, and to Peter and the team, because it was the leadership team at Delta who really carried this and made it to fruition. So I would like to just, you know, after this short introduction, just ask Peter, you know, I mean, what was it like from your perspective, and how did you, I mean, this must have been a shock. I mean, the brakes were hit so quickly that I'm sure, you know, it wasn't easy as a company to see what was ahead and what was going to happen.
Good evening, Carlos. Thank you. It's good to see you. I wish we were in the same room together, as we have been many times since it started. And I want to start by just thanking you and thanking Emory. I said earlier before folks joined that we could not have had a better partner throughout this pandemic. But going back to what it was like, I remember vividly that the leadership team was actually in Chile, of all places. And we were there in early February, and we were getting text messages about China and about the virus in China and about the fact that there were some travel restrictions that were starting. And we, at that point, I think as a team thought that it was going to be something over there. It was not something that we thought was going to be something that we had to deal with. But everybody remembers vividly over then the ensuing 5 weeks or so, when it became a huge issue in the United States. And for us, the way that manifested itself is, you may recall, I think it was the 13th or 12th of March, I may have the date off, when the NBA canceled its season. And when that happened, the very next day, immediately our bookings stopped. And then within about a week after that, we were burning $100 million of cash each and every day. And we were, I think it's fair to say, facing at that point in time, really an existential threat for both Delta and the industry, because nobody knew very much about COVID. And nobody knew how long it was going to take. And I will tell you that we pretty quickly landed on 3 priorities that Emory was, in the end, so critical in helping us execute on. The first priority was protecting our people, and our people meant our employees and our customers. The second was protecting our cash, because we were facing a liquidity crisis, and we needed to find a way to protect cash. And frankly, you know, one of the things we did is we went to Washington and got support from the US government. And the third thing was protect our future. And when we thought about protecting our people, none of us were healthcare people. None of us understood COVID. None of us understood the disease itself and how the virus worked and how viruses were even spread. None of us did. We had zero healthcare experience, you know, other than being the self-insured, you know, company that took care of employees through traditional health plans. And so it became pretty clear to us that we needed to create a partnership with a healthcare expert in this space. And I do think that Ed running into Carlos at the meeting, the ACP meeting, was fortuitous, because what it did is it led to what I'll call an unorthodox partnership. And one of the lessons of the pandemic for us as a company has been the power of an unorthodox partnership, because Emory and Carlos and the whole Emory team brought such deep scientific knowledge, experience, that we could have never, ever accessed but for Emory. And of course, we brought our business need, which was, how do we keep our people, our customers and employees safe? You know, we had to learn fast. And the thing that I very much appreciated about Dr. Del Rio in particular, because this is not always the case with every doctor we interacted with throughout this, because we had a whole panel of doctors we were dealing with at one point, is that Carlos was always able to find a pragmatic way to mitigate risk, which is different from eliminating risk, because it became very clear to us early on that our employees were going to be considered essential workers, which meant they were going to be, you know, in the danger zone, let's say, every day on an airplane, taking care of our customers. And so we were very, very concerned about making sure that our employees had all of the protection that we could provide them. And of course, we had no idea how to do that without the partnership with Emory and Carlos.
So clearly, Peter, it was, you know, I think a learning, you know, almost a daily learning for all of us, because as you know, we were also learning, we continue to learn, and everything changes on an ongoing basis. But I think the other thing that really happened is I have been very just amazed about how quickly Delta has been able to implement recommendations. I mean, I think the decision process at Delta has allowed Delta to create, I think it's an example for the industry, it's an example for business, how very rapidly you were able to do things. As you said, you were not a healthcare company, but you were very rapidly able to implement things. So, you know, when the decision was made, we need to provide access to testing to our employees, and we need to test employees regularly, because as you said, they are in the danger zone. It didn't take you guys long, and you were testing all your employees, and you were doing it routinely, and you were doing it effectively. When the decision was made to refit the airlines and change the airflow and change HIPAA filters, again, it didn't take long. You know, it wasn't, in some industries that may take months to deal. You again did it very quickly, and I can go on and on. You know, the setup of nowadays the setup of the Delta Museum as a mass vaccination site. Again, something that was done very effectively and very rapidly. So I would say that one of the things that I've been impressed and admired of Delta, and I think something that we can learn honestly, is how you guys have been able to make decisions in a very quick, effective way. And maybe I'll ask you a little bit about, or sort of, what is the decision-making process? Because again, every turn of the game, when we talked about something before I knew it, you guys were implementing it, you know?
So, you know, because we were in a crisis, Carlos, we had a meeting every morning. So this was Ed and his team, which is basically, you know, 5 of us. And we still do meet every morning at 9 o'clock. And one of the things, we didn't have the luxury to study everything forever and take, you know, time and have decks with respect to we had to make a lot of decisions quickly, especially when it came to the safety of our people and customers. And so what I would say is that whenever there was a decision to be made with respect to a layer of protection, for example, and let's say we turned to you, Carlos, and you said, yes, this will make it more safe. It's another layer of protection. We always would quickly make the decision because we knew to scale it, you know, we're great at logistics and we're great at scaling, but when you're talking about, you know, scaling a decision for thousands of aircraft in, you know, dozens or even more, hundreds of cities around the country, the faster you make that decision, the quicker it can happen. And we always put a finger on the scale. And I'm proud to say, you probably heard us say it was, we were going to put people in front of profits. We always put our finger on the scale of making sure that what we were doing was protected. And the testing protocols you've referred to, I'm extremely proud of, because what became clear to us as soon as, Carlos, you shared with us the fact that so much of the spreading of this disease, this virus rather, was through asymptomatic people, it became clear to us that we needed to test our folks to make sure that they weren't coming to work COVID positive. And so with CVS and Quest, we've got 59 testing centers around the country, and Quest we have a shipping protocol where tests are shipped to employees' homes, and we have approximately 5,000 instances where employees either came to work feeling great and were tested positive, or they received a home test and tested positive. Again, they felt great. They were totally asymptomatic. And we've been told by you, Carlos, and others that that has saved people's lives. Because if those people go to work, they might expose somebody who might expose an older person who then is fighting for their life. So really proud of being able to scale that testing program for our people. Every week, we're expecting our employees, until they're vaccinated, to be tested at least once a week, but that's a minimum. Most employees are tested 3 times a week. That also makes our customers feel more comfortable knowing that our employees are tested on such a regular basis. So I think we realized we had to make decisions fast in order to really get those decisions executed across all the operations around the world.
Yeah, as you said, you know, that kept the employees healthy and kept the infected employees out, which, you know, clearly not only prevented transmission to others, but prevented potentially what we have seen throughout this pandemic to be a big problem, which is this so-called super spreader events, right? And I think, you know, I'm very proud to say that there has been 0 super spreader events related to Delta. And because again, I think testing was a critical component. I think the second critical component was obviously the mandating of masks at clubs, and flights, and not an easy one. You know, we did not have federal government support. I spent a lot of time speaking with CDC, with Dr. Fauci, with the White House task force, trying to get them to issue a federal mandate. And there was a lot of reluctance in the White House to do that, and therefore it never happened. So it was really left down to the company, and was left down to, quite frankly, the employees. And I will tell you that as somebody who flew during the pandemic and continues to fly, it was really very tough on the flight attendants and the crew to be enforcing mask mandates, you know, because, you know, they didn't have a federal law and people will frequently challenge them. So I'm very pleased that now the federal government has a federal mandate, but that was tough. And I think your employees really stepped up to the plate and did the right thing. And I would say that increasingly over and over, I was impressed about how they were able to do enforcement and yet still be courteous and explain this to the passengers in a way that was non-threatening, but at the same time, very firm.
I think, Carlos, you know, you've identified what I think is one of the lessons of this is if we could do anything over again, it would be, A, we'd have enough PPE immediately. We'd have it stockpiled somewhere. But B, the mask, you know, thanks to your great advice, we as Delta actually required masks of our employees and our customers before the federal government imposed a mask mandate. And that was, because of your great advice. And in retrospect, I wish we had been able to do that sooner, because it clearly was one of the secret weapons and is one of the secret weapons against the virus. And what's amazing about it is that when we required it for our employees and for our customers, that was when masks were not as plentiful. And so people, were wearing gaiters and doing whatever. But I'll never forget being on a flight and seeing, just flight attendants coming up with ways of making their own masks because they knew it was important, and then we were asking them to wear masks, and they were doing so. One of the negatives of I think this past year was the politicalization. I can't speak at the end of the day, of masks, because that created a negative dynamic for our flight attendants, where some people felt like it was their constitutional right, not to wear masks. As a result of that, we've got over 1,000 people on a do not fly list right now, who, as a result of not wearing masks, are not welcome to fly on Delta anymore. Our view was that if you can't follow that very basic safety precaution, we don't want you to be a Delta passenger in the future going forward.
Now, I think a third component obviously was what I think at that point was the right decision, which was, limiting the number of people on board. And much has been made about, and I got a lot of pushback from some people, in my field, public health, saying, leaving the middle seat open, blocked, doesn't do anything because it doesn't increase social distance. And I kept on telling people, this is not about socially distance. This is about limiting the number of people on a plane. It's about just decreasing the load. And again, something that without doubt had an economic impact on the company. But again, the company very rapidly said that's the right thing to do.
That was probably one of the more controversial things we did, because we did put people before profits. Those were seats that we could have sold in many instances. And from our perspective, it was fewer people, which made the experience more positive, which fundamentally made it a less stressful environment and gave our customers and our employees some peace of mind. We're only now, as of May 1st, going to be unblocking our middle seats. And we are the last airline to do that by a country mile. And the only reason we're doing that is we've actually heard from our customers that they're ready to travel in middle seats again. And that's in large part because of the fact that, so many of our business customers are vaccinated as well. So they feel ready to get on airplanes. Now, one of the things I think folks also have appreciated, and again, we couldn't have done this without Emory, is, we disinfect every airplane for every flight, and people are still and will still be required to wear masks. And if you haven't flown on us, you will see that, when you get on the plane, I use the phrase spick and span. I mean, it almost feels like it's right off the factory floor. It's so clean. You're handed a wipe immediately. If you were to use the restroom, right outside all the restrooms is hand sanitizer. It is a very clean experience. Again, not just because that's the healthy way for folks to travel, but even with the evidence now suggesting that surface areas, don't necessarily are not the ways that people catch those viruses. It still makes you feel better. It just makes you feel better knowing that you're in that clean environment. The environment with the HEPA air filters that changes the air, every couple minutes. That's something that we want everybody to know has now become a priority going forward.
Yeah, I think that's a really important point, right? When people ask me what when we go back to normal, what things you don't want to see go away. And one thing that I don't want to see go away is how we have learned the importance of hygiene. And I would say in particular, not only having things be clean, but also the importance of hand hygiene. I think we were not cleaning our hands enough. We were not using hand sanitizers enough. And I think the fact that we have made that part of our routine, I think makes a huge difference. And I think will actually prevent many other infections. I mean, you know, again, there's so many other respiratory viruses and gastrointestinal viruses that potentially be prevented by doing that. You know, what you said is absolutely right. You get on the plane, and I think the partnership with Purell was very important. That even that little, you know, little towel of Purell you're handed on the way in, to me, it's a reminder of how important it is for you to feel that everything has been clean, and that you can do an additional hand sanitizing or receive yourself. And I have found that to be incredibly reassuring, but also a very positive a positive message to the customers, right? I think the other thing, Peter, is that we've learned in this pandemic and is the importance of communication, right? I think that communicating to employees who had a lot of questions about the virus, communicating to passengers, to partners, to everybody was a critical component. I you know, worked with you guys in whether it's doing, you know, town halls with employees or doing, you know, a town hall that was done with other partners. But at the end of the day, I think communication and transparency in the communication is such a critical component of what surviving a pandemic is about and leading in a pandemic is about. And I think, you know, the communication that Delta has done has been, in my mind, second to none.
Well, Carlos, thank you for that. You've been a big part of that, because when we needed to communicate about the virus or about the importance of testing or about the importance of vaccines, it was really important that a doctor be the spokesperson. And Carlos participated in numerous town halls and public service announcements that I'm confident made a huge impact among our people. We learned a lot about communication during this. We had been a company that was very used to bringing people together to have town halls, and we realized obviously we couldn't do that. So we started using technology differently. And we actually now have a little bit of a TV studio that we use, and the technology allows us to have a chat function. And so what's been interesting is our weekly town halls. During the town halls, people will ask questions about, well, what about this vaccine? Or, you know, I've heard that if you've had COVID, you don't need to do this. Or, you know, oh, I took an antibody test, and, you know, there's a conversation that goes on. So we've been engaging with our employees in a much, I think, more intimate way, because it's been about their health, which of course is where people live. It's the most important thing. And the other thing I give Ed credit for is every week he does an employee memo. And what I appreciate about it is from the beginning, including the message, you know, early on that we were burning $100 million of cash, he would share with our people the hard truths of what was happening with Delta. He would always do so in a very transparent way. He's one of the most transparent CEOs in the world, I think. But then he'd always say, we can get through this together, because he really knew that the Delta people were the most resilient and capable of getting through all of these types of things together. And I'm so proud to say that as a result of, I think, some of the things we did throughout this pandemic, and you know, I could provide you some detail, but we haven't had to lay off a single employee. And for a period of time, we were the only airline that could say that. And part of it was we asked our employees to take unpaid furloughs for periods of time. And I think we had 30,000 employees who volunteered to take unpaid furloughs. And that allowed us later, you know, to bring everybody back. But that kind of shared sacrifice went a really long way. You know, the other thing I'd say about communication is, as we get into our vaccination stage, and Carlos mentioned, we have We have 2 vaccine clinics in Atlanta, one in the Flight Museum and one in Concourse C, in which we can and have been vaccinating our employees. And just like the rest of the country, we're now at a place where we're facing folks who are a little reticent to be vaccinated. And nothing's more important now than just that, I'll say, relationship that we have with our employees, because they know that when we say, please get vaccinated, it's important to our customers, it's important to you and your families and your health, ultimately to the full recovery of the airline and our economy. We're seeing, just very high rates of vaccination as a result of that. So it's been really important to have resources like Carlos as part of that, because Lord knows, we're not healthcare professionals.
The other thing, Peter, is, many people may not know about this, and one of the projects that we did together and I feel most proud of, and really I say it as one of the great examples of what can be done, is the pilot of the flights going from Atlanta to Rome and Atlanta to Amsterdam. And I think, we can briefly talk about those, but to me, the whole idea is, again, how can we make travel safe? But more importantly, how can we prevent people having to quarantine when they arrive to their destination, right? And that was the other component, that for people, when the Atlantic corridor, North Atlantic corridor, was virtually shut down, you guys kept some flights going, and you were able to figure out a way to work with certain governments who would say, okay, fine, as long as you follow the following rules, your passengers will not require to be quarantined. And that allowed people to then travel and use those flights in an effective way. So the whole principle was, how can we have what I tell people is a COVID-free flight, right? And the idea was, you get tested, you get a PCR test 72 hours before departure, you get a rapid test at the time of boarding, and you get a rapid test at the time of arrival to your destination. But by doing this, I think, again, we have avoided people getting on planes infected, but more importantly, people have been able to arrive to their destination and go on to their business and whatever they needed to do without necessarily having to then stay in 14 days of quarantine like is required in most other places. So you want to talk about that a little bit? Because I think it's just such a cool project. Oh,
Carlos, it's to me one of just it's exhibit one for how this partnership did very innovative projects that otherwise we would have never been able to do. Last year, it became clear to us that we needed to find a way to allow people who need to go to Europe without a quarantine. Because right now, in almost every country in Europe, if you go, you have to be quarantined. And we were focused on Italy for a host of reasons. To go to Italy today, you either need a European Union or Italian passport, and you need to be basically considered an essential worker. So you need to be going there, either be for business of a certain type, as a diplomat, might be healthcare. There's certain categories. Their categories are a little broader than most of the other European countries. And we thought that if we could build a pilot with the advice of Carlos and Emory, and we also partnered with the Georgia Department of Health and the CDC around testing, that might be something that the Italian government would consider as a basis on which to lift the quarantine. So we started this building the protocol again after spending time together with the team. The protocol we settled on was a PCR test up to 72 hours before departure, and then a rapid antigen test at the airport. And then when you land in Rome, you'll take another antigen test. So we got the Italian government to agree that with those 3 tests, you would not have to be quarantined. We launched that pilot project roughly the week before Christmas.
Yeah, December the 18th.
Yes, you know exactly a week before Christmas. We've been running those flights since that time. I think we've had 5,900 passengers since, and the facts are that we've had 4 people test of the 5,900. We've had 4 people test positive at the Atlanta airport with the antigen test, and after that you test positive, you take a second PCR test, and half of those people tested negative with the PCR test, so they got to continue on. Half of those people tested positive and had to be quarantined and leave the system. And then upon landing, I believe there's only been 1 or 2 people who tested positive at landing in Rome. So it's been a huge success, so successful that we've shared the data with the CDC, and the CDC is considering those kinds of protocols for opening up international travel more broadly. But this has made a huge difference for not just lots of customers, but for our employees, knowing that we can continue to travel and provide service internationally to an important center like Rome. And I think also, that pilot has created a data set, which is very, very powerful for us in scaling for other flights in the future. Because one of the things that Carlos alluded to, which we've begun to believe, based on the variants, based on the discussion around booster shots, is we tend to believe that if we're going to have to live with the coronavirus for maybe years, maybe forever, we need to learn how to live safely and travel safely and provide ways that our customers can travel safely everywhere in the world. And these are some ways that we've learned folks can travel safely. And by the way, there's been no outbreaks associated with any of those flights, 0.
So Peter, I think you're entering now the territory of some of the questions, so I'll talk about those. I mean, one of the questions obviously is, how are we going to be doing, vaccine verification and what kind of things for testing? I'll say my own example. Last 2 weekends ago, I traveled to Mexico, and as you know, now when you travel internationally, you have to return and you have to get a test 72 hours before you fly back to the U.S. So I got tested in Mexico, and I found it very effective. The little link that Delta has incorporated into your reservation that allows you to upload your test results, and basically a system verifies that true is a valid test. And once you've done that, then you're giving a little thing that says, you can see it here. It says test verified, and with this QRS code, then you can get through different points. But I mean, there's a system that you guys have implemented that allows you to know you're going to be in this flight and your test has been verified. I know Clear and other companies are looking at ways to verify vaccination and other things, but I clearly see that in the near future, we will be having a similar verification process for passengers that will be linked to your vaccination record.
Yeah, we've got a whole innovation team, Carlos, that has been developing an open source agnostic technology that, ideally, the way it's been described to me is you think of a data lake, and that data lake would be your vaccine token or your test token. And so if you're going into the UK, an app, and it could be Clear, it could be Common Pass, it could be the Delta app. We're hoping to actually integrate it into our boarding pass. Will show what your vaccine status is. We're working with CVS and Walmart and all of the major vaccine administrators around the country to have them reach out to folks who they have vaccinated to seek consent to create this database. It's not healthcare record. It's just a who's been vaccinated record, which many people are comfortable making sure that information is known if it gives them privileges. And that's that's what we think is going to be the thing that accelerates reopening of Europe, is that we think that the European Union, well, they've already announced over the weekend that they support this, and the UK are going to say that vaccinated Americans can travel in Europe. And then for those who aren't vaccinated, there'll be a testing protocol like what we've described. And I think we're going to have to all be accustomed to that for a period of time.
Yeah, no,
it's the new reality.
Absolutely. And I think, Europe already assigned that by the summer, they're going to be allowing travel provided that you're vaccinated. So I think a big component is going to be, how do we ensure that you have the right record and you have the right verification of the individual, right?
Yeah, and it's all, the power of an app form of a cell phone, right? It can all be in your hand, which you pointed out. And fortunately, this is something that there's tons of collaboration around. Right. And so while it sounds like a massive undertaking, I actually think, and the government doesn't want to get involved, I think there's going to be some real customer friendly solutions.
Yeah, I mean, I think it's going to come from industry. And again, it's one of the things that I'd rather have business than government tell us and guide this. It's going to be a lot better. One of the questions that comes up is that, with Delta putting people over profits, it's clear that Delta is a business of social good. Has Delta always taken this approach? And if not, when and how did the business culture shift?
I think that we've always believed that we believed in what was called the virtuous circle, which was we need to take care of our people because they'll take care of our customers and our customers will take care of our shareholders. So our culture was always about taking care of each other, and that was really, I think, it celebrated servant leadership. It's kind of that upside down pyramid that you've probably heard about. And what I'd say is a little bit different is that this year, I think we were put in a position where we had to make decisions that were solely focused on the health and safety of our people and our customers, with the hope and belief, by the way, that would create some goodwill for the future. And we don't know, by the way, if that was correct or not, if ultimately that's something that will be appreciated in the marketplace. But we made the right decision without a question. And I do think that corporations today have an enhanced, I'll say, responsibility to the communities they live in and to their employees, to all the stakeholders. And that's something we take very seriously.
I would say that coming from the outside and sitting in meetings with you and others in the leadership of the company, companies always talk about culture, but in my mind, culture is something that you can smell, you can see it, right? I mean, one thing is the corporate statement, the very different thing is what you see and what people talk to you about. And I would say that going into meetings, it was very clear to me that your employees understand that culture, and actually it really shows that culture is actually at the core of Delta values. And I would say, I mean, I'm confident that it's not going to go away, that it will be part of Delta's DNA. It's part of Delta's DNA and will continue to be part of what Delta stands for. And I think that in a great part is part of the success that Delta has had. It's always so hard to work against culture, but here was very easy because that was the culture. One of the questions that comes up is, in this Emory Delta partnership is still up and running. I don't consider the pandemic over. Somebody says, no, clearly it's not over. And we continue working together and we continue collaborating. And I think my hope is that, this is, as Casablanca, the movie says, this is the beginning of a very long-lasting relationship. I think that we have learned a lot of things, how to work together. And, now with, Henry Ting as the chief medical officer of Delta, Henry came from Mayo Clinic, and I've had multiple meetings with Henry, and Henry's very clear. Look, I came from Mayo, but that doesn't mean I need to, my partnerships in healthcare and public health don't need to be with Mayo. I mean, I have Emory right here. We need to continue seeing how can we strengthen the partnership and how can we do better things with Emory to really benefit, the population at large that works for Delta, and not only the employees, but their families, et cetera. So I think there's a lot of things that could potentially lead to a much better working relationship. And my hope is that, again, this is the beginning of a much more, relationship that benefits both organizations.
Carlos, I couldn't agree with you more. There's no question that we will continue to work together, and because we know how important it is. I was saying earlier that we have become a little bit of, or at least we've realized that we need to be a healthcare company. And to do that, we can only do that through partnerships like the one we have with Emory.
So one of the questions people have is, are you concerned by a flight, the flight to Hong Kong that was recently reported, in which, people were tested and then 52 people were found to be positive after a few days while quarantined? I think that's a one-off. I'm not concerned. I think, again, it talks about the testing. And again, I don't think one thing is going to prevent everything. There's a component of we in this world of public health have talked in this pandemic a lot about the Swiss cheese approach. It's not one thing that you put in, but it's multiple layers of protections that you put in place. And I think the more layers of protections, the better you are. And I think, you have to think about, vaccination and testing and masks and hygiene and air circulation and all those different things together as a way to mitigate risk. At the end of the day, if you cut corners and you say, I'm going to do testing and that's all I'm going to do, and then people are going to be able to unmask, you're going to run into a problem. And I think at the end of the day, we want to be, as long as this virus is around, we want to be as careful as we possibly can. And it changes the travel experience. There's no doubt about that. The meal services are different. The ability to eat in a plane is different. A lot of things are just plain different. But I think it's just the compromises we're all going to have to take, right?
Well, I'll give you our take on that, because we did do an investigation of it, and it really is a failure of it's a small Indian airline. And as we were briefed, almost no masking on board. And by the way, apparently in India, they have quite a problem with fraudulent tests. So you've got an airline that wasn't enforcing masks, and you've got an airline that wasn't verifying tests or accepting, pieces of paper that clearly were not legitimate. And the good news is that upon landing in Hong Kong, they were all tested, and that's where ultimately they were found to have included some COVID positive travelers. We've been told that chances were very high that many of those people, got on that airplane COVID positive. I can tell you that in the U.S., if you're flying one of the major U.S. carriers, in fact, I'd say any U.S. carrier, that would never happen because of the, masking requirements, and also all of the carriers have become better at cleaning their aircraft, and including, as you say, the Swiss cheese of protection.
And I don't want to discard, and I think you want to talk a little bit about, the changes in the air circulation and the air filtering. I think those have been huge, and again, really important, and something that I don't think is going to go away.
Well, it won't go away, and it's something that nobody even at Delta fully appreciated, that our aircraft, use HEPA air filters, which is, basically what a hospital emergency room uses. And the air recirculates less than every 3 minutes, so you're getting fresh air pulled through the aircraft. And every study of the air quality on an aircraft has concluded the same, which is it is, fresher than the home in a grocery store, in your house, and it's extremely safe because of that HEPA filter process. And that will never change. And we've even decided to change those filters twice as often as required, just to make sure that it's even better and higher quality air as a result.
And you're also I mean, from the discussions we've had, your engineers are also bringing more from the outside, which is, again, has a cost in as far as fuel and other consumptions, but it really changes and increases the quality of the air coming in, right?
No, that's very true. I think that the thing that again, if you fly in us, you will feel like you are in a safe environment, and that's ultimately what we've set out to do, and of course we've done with the help of Emory and you, Carlos.
So I want to end just by talking about the sort of the next steps, right? I mean, I think all of us, as you said, a year ago were hoping that this was, first of all, not going to be as severe as it is, but second, I don't think a year ago none of us would have said, oh, a year from now we're still going to be in this. And the reality is that I think we're starting to move from crisis to recovery, but we're also to a little bit of ongoing sort of living with this pandemic for longer than we expected. And how do you see Delta adjusting going forward into the different things that are going to be necessary?
Well, first of all, I think that we will be simplifying how we interact with our customers going forward. One of the things, like you've read in the rest of the world, is this has accelerated the digitization of Delta. And so I think you're going to see the ability for you to, for example, order a particular beverage from the seatback entertainment, for example. We realize that simplification and minimizing the interaction between customers and our flight attendants is a positive thing to do in light of the fact that we're living with a virus in the world. I think that the other way, we've introduced contactless payment technology into our aircraft, which has been meaningful. What I think, though, when we think of the future, we think that we're going to have to maintain certainly all of the cleaning and safety changes we've made. But I think we're going to have to also focus more and more on sustainability as an airline. That's become critical to our success in the long term. And so one of the things we did over the pandemic, because we didn't have a need for so many aircraft, is we were able to retire some of our older fleets, which allowed us to bring in fleets that are, more than 25% more fuel efficient, which of course is a big part of our carbon footprint. So you're going to see us continue to focus on meeting some of our sustainability goals in the future. And I think from a health and public health and well-being perspective, our chief health officer, he's actually not brought in to focus on COVID or COVID recovery. He's really brought in because he has a vision to try to transform the way healthcare is delivered to employees and to people. And his view is that the health insurance industry isn't going to do this for us, and that really the consumer of healthcare, which of course we are with 80,000 employees, can perhaps have a role. So I see that as presenting huge opportunities with Delta and Emory, because it could include having clinics. We have an Emory clinic now on campus, but having clinics throughout the system and really owning our healthcare for our people, the health and well-being of our people in a way that's a little more distant today. I think that's going to be very exciting. It's an audacious goal, but it's really critical in light of what our people have just been through.
And Henry and I have talked about, right, how do we transform the care of Delta employees into much more focus on prevention, right? How do we focus on, improving, diabetes management and hypertension management and obesity, and improving vaccination rates and doing all those things to because again, keeping employees healthy will decrease one of your biggest costs, which is healthcare, right? So at the end of the day, is part of I think one of the futures that we see out of this pandemic is how can we actually decrease our overall expenditure in healthcare, which as a nation is one of the biggest consumers of GDP that we have.
Well, I think we spend $1 billion on healthcare every year because we're self-insured, and I don't think our outcomes are all that strong, and they can be improved. And the big, I think, area that we talked about before we all got online this evening is really about wellness and mental health. And remember, flight attendants, their offices are metal tubes flying at 35,000 feet, and they're on their feet all day. They're dealing with the human race, and then they land in a city and they stay in a hotel, and then they do it all over again. Very stressful. We need to figure out a way our employees can do what they do every day without carrying so much stress. And of course, in a pandemic, that stress is multiplied.
Absolutely. Well, listen, Peter, I want to thank you for your time, and I want to again congratulate you and Delta for everything that you've done. I think the partnership and the way we work together and the way I've seen Delta deal in this pandemic is simply something that, as an Atlantan, I'm incredibly proud of, and I want to congratulate you, and I want everybody to know what an amazing company we have here in town.
Carlos, thank you for that. I appreciate the opportunity, but I most of all appreciate you and everything you've done as our partner through this, and all of Emory, because we couldn't have imagined a better partner on the front end of this. And as I said earlier, we couldn't have got it through this without the deep partnership.
Well, thanks so much, and I'm going to turn it over to Michelle.
I can only thank both of you very much for this remarkable conversation, as we have been privileged for your real life conversation about this very challenging time and your most impressive, unorthodox partnership. Thank you both very much. Thank you for this evening. I thank you on behalf of our educational programs, our alumni, and our community partners. And I thank you on behalf of the Center for the Study of Human Health and our educational programs. Thank you so much, both of you.
Have a good evening.
You as well.